Hello, everyone, and welcome to my course called Drug Abuse and How to Identify and Treat It in the Dental Field. This is the basics. So, the purpose of the presentation today and why is it important? So, the goal of this presentation is to refresh and inform you guys, the dental professionals, of the severity and prevalence of drug abuse and how to recognize and care for patients who are involved with substances. The recognition of substance abuse always needs to be at the forefront of dental professionals' minds because it can drastically affect the work we perform and also the patient's oral health. So, for example, the patient who's been a long-time drug user will metabolize anesthetic faster and be resistant to it. I'm sure we've come across these patients many times in our practices. This presentation also serves to give a brief description of the kinds of drugs and medications that are utilized in the office. So, very, very important information today. It's always good to get a refresher on this stuff. So, part one, we're going to start with drug identification. And I'm sure you all know what a drug is, but we're going to go through some of the terms for it. A drug is a substance used as a medication or in the preparation of medication. It's something and often an illegal substance that causes addiction, habituation, or a marked change in consciousness. A substance other than food intended to affect the structure or function of the body, a substance intended for use in the diagnosis, cure, mitigation, treatment, or prevention of disease. And then all of these drugs are listed in a pharmacopoeia, which is a book describing drugs, chemicals, and medicinal preparations. And I'm sure, especially the doctors here, have looked at this before and know what I'm talking about. So going into the different types of drugs, there's so many different kinds of drugs. Some of these include alcohol, cocaine, hallucinogenics, heroin, inhalants, LSD, cannabis, MDMA, methamphetamine, prescription opioids, steroids, synthetic bath salts, basically, tobacco and nicotine, all different kinds of things, all used for different ways, all affect the body differently. Some of them are more abusive potential than others. So we're going to go into that. We're going to start with the drug schedule. So this is the schedule basically that talks about the abuse potential for each different kinds of drugs. So, starting with the number one schedule, this is very, very high potential for abuse. So, this is the stuff that's like MDMA, ecstasy, marijuana, LSD, things like that. Things that are not, given out by doctors, they're not prescribed. Going down one notch, you've got a very high potential for abuse, but it is accepted for some medical uses. So, morphine, cocaine, things like that. I feel like morphine is much more common than cocaine to be used as a prescription, but they all fall under the same schedule there. Number three, going down, more common, codeine. They do have some accepted medical uses, but it's a less likelihood that it's going to lead to dependence or psychological dependence. Then Schedule 4, we're getting lower down, benzodiazepines, phenobarbital. Schedule 5, very, very low abuse potential. So this is kind of where everything is categorized in, and there's charts online that show what every drug is categorized into here. So we're going to go into some of the drugs and medications used in the dental office, since these are the ones that we see every single day. So the medications in the dental office are used to treat many different conditions, such as infections, pain, and anxiety. So of course, every dentist practices differently, and different people believe in different things depending on what they think works best. And so but here, these are some of the most common ones. So these are the medications for pain and anxiety. Of course, we use local anesthesia. We've got injectable lidocaine, Septocaine. We have the topical ointments as well. General anesthesia, more commonly used in the oral surgeon's office. And as always, nitrous oxide. We always have those patients that are very, very nervous. And very, very commonly, anti-inflammatory medications, Motrin, ibuprofen, Tylenol. We see that all the time. And in rare cases nowadays, opioids can be used as well. Here's some more drugs and medications in the dental office. These are drugs, medications here, but they are used. Chlorhexidine, all the dental hygienists are familiar with this one. Antiseptics, of course, Oracare, Listerine. Anti-tooth decay medications, so fluoride toothpaste and fluoride varnish. Anti-dry mouth medications, pilocarpine. Antibiotics, of course, tetracyclines, antivirals, antifungals, muscle relaxants, all things that we use here in the dental office. So talking a little bit more about the dental drug schedules, though, the majority of dental medications would fall under a class 4 or 5. So I mean, we prescribe a lot of um, Motrin, things like that. So we're not too concerned about those. Obviously, the small minority of dental drugs that could be potentially causing addiction is, of course, opioids. Narcotics are a Schedule 2 drug, which means they have the highest potency level drug that has still been found to have benefits when prescribed in the medical field. So scary stuff that we can still prescribe these. Narcotics in the dentistry, going into a little bit more, believe it or not, as late as 2012, doctors and dentists wrote over 250 million prescriptions for these drugs, these opioids. Opioids prescribing by dentists is estimated to be 11% of the overall annual number of opioid prescriptions in the United States. It's crazy. This is indicating that approximately 1,500 deaths annually may be attributable to unused opioids originally prescribed by dentists or therapeutic processes. That's crazy to me. That's such a high number coming from the dental field when, in reality, some of the things that we do can cause a lot of pain, but for the most part, I feel like it can be solved with, Motrin, things like that. So it's just crazy seeing this. So going into that, using NSAIDs rather than narcotics. In the past decade, attention has been brought to the fact that we've been prescribing so many narcotics. Research has been conducted to discover that non-analgesic medications such as NSAIDs are just as effective in combating dental pain as analgesics. A 2013 study published in the Journal of American Dental Association showed that when 2 NSAIDs were used together, the pain relief was greater than either drug used individually and better than some opioid medications. So this is not to say that dentists will never utilize narcotics for pain management, but there has been definitely a decrease in the prescriptions. I think a big part of the narcotic use in dentistry is attributable to the fact that people think in their head that narcotics are going to make their pain go away better than using NSAIDs. And so they almost expect for narcotics to be prescribed to them. And so I think over the years, changing that mindset is what's really going to enable us to steer away from narcotics and go more towards NSAIDs, and really just educating our patients on the fact that that's possible. So now we're going to go into a whole other part. We're going to go into abuse identification. So I put together a step-by-step plan to help figure out the patients and to identify the drug abuse. So step 1, easiest thing, is to include questions in the medical history. Now, we know it's hard to go into the medical history and say, do you use cocaine? But we can use this medical history to ask questions such as, do you use tobacco? I mean, we probably all have that question on our medical history. And people, for the most part, are pretty honest about that. If they use maybe alcohol, tobacco, things like that, they'll open up about it and they will let us know if they do or not. Step 2, create a baseline and observe changes over time. Well, who is the most qualified to do this? Probably the hygienist. We see them every 6 months. We spend an hour with them, and we can really get a feel of who they are, what's the norm for them, when it's not. Oral and behavioral changes can be noted in the patient chart. Oral changes can also be documented with intraoral photos. So definitely what's going on inside the mouth, we're going to notice it. But personality and behavioral things, definitely we can definitely see. So these are some of the 10 most common behavioral signs of drug use and addiction. 1, intense cravings. 2, tolerance. 3, withdrawal symptoms. 4, physical dependence. 5, engaging in increasingly risky behaviors. 6, drug-seeking behaviors. 7, financial trouble related to drug use. Neglecting responsibilities. Developing unhealthy relationships with those who support addiction. And 10, isolating behaviors. Now, of course, we're probably not going to see the majority of these signs because we only see them once every 6 months, 3 to 6 months, depending on the patient. But, we'll know if somebody who is very calm and relaxed, the majority of their appointments, they come in all the time, they just sit in the chair and they're calm and easy to talk to. And then they come in and all of a sudden they're just like on something, and you can just tell they're super jittery, they're super on edge. There's obviously something going on there, and there could be other reasons, but probing into that will help us realize that. So now we're going to jump into some oral manifestations in drug users, and we're going to use the most common ones here. As always, smoking nicotine. We see it all the time. Hygienists, that brown stain, we cannot get it off. It is such a pain. But we'll know pretty quickly if, they're a smoker. That brown stain is definitely very unique to smoking nicotine. Some other signs are dried out tissue on the palate. We know that is nicotinic stomatitis. Bad breath. Oh, yes, we know when they smell of smoke. We can tell immediately. Significant decrease of bleeding despite pocketing and active perio disease. We all know those patients that have raging perio and not a drop of blood, but they smell like smoke, so we just know. And of course, cancerous lesions, because if you smoke nicotine, you're more likely to develop oral cancer. And an increase of dental caries because of that dried out mouth. Chewing tobacco, very similar. A lot of the same things, but often we can see the leukoplakic lesions where they hold their chew. A lot of people are very quick to point it out. Oh yeah, I hold my chew over here, so that's why you probably see this white patch. And you can ask them, oh, do you chew here? I see this white patch here. And then of course recession as well. We all know what that looks like as well, where they hold their chew. Marijuana. So this gets more of a green-yellow stain. It can. Definitely bad breaths. You can smell that marijuana just like the smoking. Increase of dental caries, again, from the dried out mouth. And then of course dried out tissue there. And I've included some pictures. Moving on to something a little bit more serious. Cocaine. Again, increase of dental caries, stomatitis, loss of papilla on the tongue. And the most interesting ones to me, nasal septum perforation and palatal perforation. Got these lovely pictures here. Of course, if you see somebody come in and they've got this palatal or nasal septum perforation, I think it's pretty obvious what they've been doing. Methamphetamine, meth mouth, black teeth, erosion, mucosal lesions, rampant caries, and absence of many teeth. This one always gets me the most. Every time I see it, it's just, ugh. But yes, that's exactly what it looks like there. So if we see any of these signs in the mouth, what we're going to do is we're going to gently probe the patient for information. It's important to take a clinical standpoint because in situations like this, you don't want the patient to feel like they are being judged. And it can be a touchy subject for many patients. So use facts and then use the images to support why you're asking. Take lots of intraoral pictures. So for example, Mr. Jones, I see that you have a white spot forming along your lower gums here. Let me show you a picture. Are you holding any food or substance in this area that may cause a change in the tissue? In this instance, the patient may be sucking on mints or holding them in that spot. So it's important to leave the room open, to leave room for other possibilities. It's good to ask open-ended questions. That way they can't just answer with yes or no. Let them explain to you in their own words, and what they're willing to open up to about it as well. Because you don't want to come off like you're assuming things too. And then step number 4, this is probably less common, but if we do have those patients that have the nasal or palatal perforation there and we suspect that they're on some pretty hard drugs, we can always try to sneak in a referral to a behavioral health provider to recommend that they go see their primary care physician, something like that. The best option for them would definitely be to get help from a specialist who's more equipped to assist them in their journey towards recovery. We're more so just pointing them in the right directions. All situations are different, and some patients may be very closed off, of course, as I mentioned earlier. But another option is to give them a number to a drug abuse hotline. If you're having that conversation with them and they're expressing to you that they want help or anything like that, this is a really good option. So in conclusion, it is important for dental professionals to be able to know the basic signs and symptoms of drug abuse and to have an idea of how they would handle it if they do come across a patient who suffers from it. Offices should have a local behavioral health provider that can refer to, and they should also have the number of the drug abuse hotline handy, as I mentioned before. I'm including with you guys, I'm going to give you all a handout. It's got some different websites that talk about the drug abuse and how to handle in the office, and I'm also going to give you a handout with a couple different drug abuse hotlines. That way you can print it out and put it in your office in case you ever need it. So overall, though, it is important that we treat all patients with substance abuse disorders with care and to show that we want the best for their overall health along with their oral health. We care about them. We want them to feel like they matter to us, and we don't want them to feel judged at all. We just want them to know that we can help them out. And then here is some references that I put in for you guys. Just email me if you have any questions. and I'd be happy to answer them. Thank you so much for watching.